Aloha, I am Dr. Taketa-Wong, founder of Dr. Catherine Taketa-Wong and Associates. Part of my mission as a doctor is to educate and empower as many people as I can with their health. So I'm glad to be with you for today's very important Facebook Live event because when it comes to CBD oil and medical marijuana, there is a major need for people to understand what to look for and also what to look out for. Many of you have probably heard about CBD oil and medical marijuana. Today I'll be explaining what the differences are and their potential uses in medicine. CBD stands for cannabidiol, which is a compound in the cannabis plant. Here's something that many people aren't aware of. Our brain actually makes cannabidiol and other similar compounds naturally. They are called cannabinoids. They regulate things like mood, appetite, and pain. In other words, as with many other compounds in our body, nature thought that cannabinoids were so important that we come with them built in. So when we take CBD or marijuana, it is working through the system in our brain that naturally makes and uses these compounds. 3 pillars form the foundation of our practice. They are to heal, to educate, and to empower. Today's event is a perfect example of those pillars. You will learn how CBD and medical marijuana each have a place in the medical field and how they can safely help people with certain conditions, including seizures, cancer, anxiety, depression, insomnia, pain, and hyperactivity in both ADHD and autism. They may also play a role in regulating the immune system, so I have found them helpful in some cases with immune system disorders. At our naturopathic practice, our mission is to identify and heal the causes of an individual's condition by combining highly advanced science and cutting-edge diagnostics with natural remedies, both modern and ancient. Many patients come to us from regular practices because they are tired of the shortened visits and the pharmaceutical medications with their side effects. My specialty is the medical treatment of autism, ADHD, and other special needs. Our other 2 doctors specialize in women's health, autoimmune diseases, weight loss, gut health, and other complex conditions. We welcome new patients, and to make sure that our practice is the right choice, there is a no-charge phone consultation with me in advance of scheduling your appointment. This is so that I can talk with you personally about your concerns and also make sure that it's the right fit to work with us. Our phone and other contact information is on our Facebook page. Whether it's CBD oil or medical marijuana, both come from the cannabis plant, which has many different species and strains. Some are classified as marijuana and have a component called THC. THC is the element that causes intoxication and does carry a risk for problem use. However, for certain conditions, THC has a higher potential for therapeutic benefits. So medical marijuana may provide more effective medical treatment in certain conditions. The most commonly used form of cannabis in our practice is CBD oil, cannabidiol, typically taken orally. CBD oils that are labeled full spectrum have a naturally occurring amount of THC of 0.3% or less. That conforms to the legal limit and allows CBD oils to be purchased over the counter. There are no intoxication properties with CBD oil, even at high doses, such as are used for seizures. Some people need to be sure there is no chance of even a tiny amount of THC in their system due to their work requirements. So, some CBD oils remove all the THC. The trade-off is that the substance may be less effective. All of the THC is removed, depending on the condition. However, in some cases, people don't notice any difference. I've had patients ask me about the difference between marijuana and medical marijuana. Aren't they the same plant? Yes, they are. However, Medical marijuana is grown to produce a specific amount of THC that can then be measured. Whether used orally or smoked, it can be dosed appropriately like any other medicine. There are also limits to the type and amount of pesticides that can be used. Black market marijuana has no requirements or regulation, so besides being illegal from a medical perspective, we're not likely to know how it was grown, and the dosage is sketchy if it's available at all. This is especially true because today's plants are typically bred to have a much higher THC level than just a few years ago. In a moment, I'll be talking about how we use CBD oil in our practice, but first, I find that patients do call and talk with me after viewing a video or two or visiting our website, and some do become patients. You're welcome to schedule a no-charge phone consultation with me. Our phone number and other contact information is on our Facebook page. I also encourage you to visit the online supplement store that I founded as a fundraiser for special needs children. Whether it's vitamins, supplements, herbs, or other nutrients, they are all tested for purity and quality by independent labs. There is a 20% discount, and our store is the only one where proceeds go to helping special needs families with the cost of their child's treatment. The store is on our website at drtaketa-wong.com. That's Dr. Taketa-Wong, one word. In my practice, I typically prefer to start treatment with CBD oil. Depending on the condition, if that is not working well enough, then I may recommend medical marijuana. With children, one of the most life-changing uses of CBD oil that I've seen in my work, especially those with autism, is with seizures. It's definitely made a significant difference in reducing their frequency and severity. I've seen it be helpful for adults with seizures as well. For many patients, CBD oil has allowed them to decrease the dosage of pharmaceutical seizure medications, sometimes dramatically. CBD oil has also proved effective in autism when children have aggressive or violent behavior towards others or themselves. Some children will bite their arm, bang their head on the floor or wall, hit their head or their tummy with their fists. The CBD oil helps calm the child and can improve their behavior, often because it can work on some of the underlying causes, which can include pain. However, I want to emphasize that I don't believe in using it as a sole solution to the child's medical problems. I am always looking for underlying causes. Even if CBD oil helps with behavior, there could be inflammation in the brain or gut or acid reflux or other medical problems that are causing the behavior. CBD oil is not a substitute for laboratory testing and an appropriate workup to figure out what is going on with the child and the needs for specialized medical treatment. Another use for CBD oil is with oppositional and defiant behavior. I know sometimes children, and especially teens, can be a handful by nature. That can be part of the maturation process, but there is a major difference between kids being kids and a diagnosis of oppositional defiant disorder. I'm talking about situations that are extreme. These children are excessively volatile, violent, aggressive, and hostile to anyone in authority. If you tell them not to do something, then they must do it. If you tell them to do something, then they have to not do it. It's a reactive impulse that they often cannot consciously control. What's often going on with children like that is an imbalance in their neurotransmitters, their brain's chemical messengers. Sometimes it can stem from issues with gut bacteria, even in children without autism. I do the same kind of workup either way. It essentially stems from problems with the brain and is not due to poor parenting. Because the behavior is often the result of an imbalance with neurotransmitters, I've definitely seen improvement with CBD oil. It calms them so they're not as extreme and more in control of their reactions. CBD oil can also be helpful for anxiety, insomnia, pain, and other conditions that can involve these kinds of things. I've also seen it helpful for OCD and hyperactivity in children with autism or ADHD. Early research suggests that CBD oil may be helpful in autoimmune conditions. This research is not conclusive, and I have not seen it make a huge difference, but it does seem to be helpful with certain conditions and may help to regulate the immune system. I want to transition now to talking about medical marijuana. One of the conditions that responds better to medical marijuana than conventional treatments is cancer treatment, particularly when it involves chemotherapy and the nausea, pain, and vomiting and lack of appetite that can be caused by chemotherapy. I've had patients who have found that medical marijuana can make a big difference while going through chemo. Their pain was more manageable, they rarely had nausea, food was more appealing, so they were able to keep their weight up. People with chronic conditions involving low appetite or who struggle to gain weight may also find medical marijuana beneficial. I've also had cases of children with autism involving extreme violence having to be given oral medical marijuana because nothing else was working to calm down their brains. These children are those who had a significant safety threat, that they are a significant safety threat to their parents, themselves, and others. The family may be fearful for their child or their own life because the child is not sleeping, beating up family members, injuring themselves, and destroying the house. I want to emphasize that these are cases where the family has typically tried everything. The child may not be able to tolerate antipsychotic medications, and high doses of CBD oil is not enough. It's a risk-benefit decision medically. Yes, there are some risks with children or teens taking medical marijuana, but if that's what's going to bring safety to the family and to the child, then it can be worth it. Also, there are some cases of anxiety where if CBD oil is not effective, medical marijuana may help. I trust our discussion about CBD oil and medical marijuana. What I'd like you to take away from my talk today is that cannabis, when prescribed properly for certain conditions, can be a helpful treatment. But it's important to work with a doctor who has experience and the scientific and medical know-how to be able to properly treat and prescribe. You're welcome to talk with me personally about any health concerns that you may have so that you too can be empowered with your health. All of the contact is on our Facebook page. Mahalo, and I look forward to seeing you in 2 weeks. Aloha.